Hi, my name is Aaron Gerds, and I'm the editor-in-chief of ASH Clinical News. Welcome to this month's From the Desk of. Hot off the press is our September issue. Let's take a quick look at what's inside. In our feature article, we examine the vital role of patient groups. The article explores the essential role they play in bridging the gap between medical care and the broader needs of individuals living with hematologic conditions. These groups offer peer support, accessible education, and advocacy, services that often extend beyond what clinicians can provide in traditional appointments. By connecting patients with authentic sources of information, patient organizations help counter misinformation and empower patients to take an active role in their care, which can improve outcomes and even boost clinical trial participation. Leaders from organizations such as the CLL Society, the National Blood Clot Alliance, and the International Myeloma Foundation describe how these communities provide both small A advocacy, like navigating insurance issues, and big A advocacy, such as shaping policy and influencing clinical research priorities. They also cite examples where patients' feedback has directly informed practice-changing studies and validated symptom assessment tools. For physicians, partnering with patient groups offer opportunities to enhance patient care, amplify research efforts, and expand professional visibility within specific disease areas. The article emphasizes that the credible organizations typically have recognized medical advisors, vetted educational materials, and transparent operations, and suggests that clinicians proactively recommend reputable groups to their patients. Engagement can range from short-term commitments, such as leading webinars or reviewing materials, to deeper collaborations that influence trial design or community outreach. While time or funding support can be valuable contributions, many clinicians find their involvement personally fulfilling and impactful. Ultimately, patient organizations serve as trusted allies, enriching the patient experience and advancing the field of hematology through shared knowledge, advocacy, and collaboration. In our editor's corner, Dr. Samuel Bano reflects on the power of a growth mindset in medicine, while Dr. Javeri's letter to the editor addresses the silent and often unseen weight of moral injury in clinical practice. Education takes center stage with our You Make the Call, as discussed by Dr. Gloria Gerber, who walks through a complex patient presentation of macrocytic anemia, Coombs negative hemolysis, and pulmonary embolism. We also explore the practical tips for treating patients who are on GLP-1 medications who also have hematologic conditions. And we debut our new wellness column because taking care of ourselves is part of taking care of patients. In Blood Beyond Borders, we traveled to Pakistan to see how the nation's hematology field has evolved over the past 30 years and why the future looks bright. Plus, don't miss our news from the blood journals, literature scan, ASH directions, and this month's data stream. Well, that's all we have for this month's From the Desk of. I'm Aaron Gerds, and until next time, keep the blood pumping.